Hello, my name is Addie Dawn. This is the final video of a six-part series on what to expect when you arrive at a crisis center and a psychiatric unit. I am a medical professional in the psychiatric field for the past 20 years and have been offering this information to all of you. And it has been based upon what I have been watching regarding videos of people speaking about their experiences at psychiatric hospitals, and many have described negative experiences. And I would rather see that people not be so fearful and get the help that they need when they are in a depressed state, or a manic state, or a psychotic state, or whatever may be the case. The medication series I want to speak on here has to do with the various medications that are available. There are older, what they call typical antipsychotics, antipsychotic medications, I should say, for psychoses, which is delusions, hearing voices. Those are Haldol, Prolixin, some of the older ones. Not Prolixin, Thorazine. Those are some of the older ones that were used. In 1970, lithium was introduced for the manic phase of bipolar, and Lamictal has just been approved now since 1970 for the manic phase of bipolar, and it is a newer medication with a lot less side effects. And the older ones have side effects. The older meds have a lot of side effects. Tardive dyskinesia, which is irreversible facial tics, movements of the tongue, Parkinson-like syndrome, shuffling, shaking of the hands, stiffness of the body called dystonia. And that's why the older ones were often given with a medication called Cogentin or even Benadryl to prevent some of those side effects. They're still very effective, but they are not the preferred medications now. Newer atypical antipsychotics, Risperdal, Zyprexa, Seroquel, a couple of others, those are the newer ones now, and they work differently in the brain, and they don't cause those type of symptoms as readily. There is the possibility, but it's far less than it used to be. And so those are some of the atypical antipsychotics. Are also being used off-label for bipolar, such as Seroquel, and a few others also. And there's antidepressants, the selective serotonin reuptake inhibitors, the selective norepinephrine reuptake inhibitors, or norepinephrine type medications, dopamine, etc., those types of neurochemicals in the brain. And, it would be a whole other study in what is the scientific basis of how that works. You can look that up if you're interested, or maybe some of you are very aware of it. And so those are some of the medications that would be given. The benzodiazepines are used for a lot of anxiety, but they're highly addictive, and they have a very bad withdrawal. Alcohol and benzodiazepines are the two drugs that can cause seizure upon abrupt withdrawal. So you want to be careful with those. The medications basically are titrated up over a period of time. In some cases, a patient only needs 10 or 20 milligrams of a certain medication, or 2 or 3 milligrams, whatever the dosing may be. In other cases, the medication needs to be titrated over time. Lamictal is one of those medications because in 8 out of 100,000 people, it can cause a nasty rash called Stevens-Johnson syndrome, and that's fatal. So don't let that scare you. That's so rare, and that's why it's titrated up so slowly and often done in the setting of a hospital. There's a lot of scary side effects with any medication out there. So, whether it's heart medication, diabetes medication, or medication for a psychiatric disorder. The doctor will work with you with these medications. Work with the doctor. Tell the doctor the symptoms you are having. You do not have to live with feeling tired all the time or no energy. When you see the doctor on daily rounds, as I had explained in another video, the doctor will ask you, how are you doing? What are your side effects? How are you feeling? Talk about it. Write it down if you can't remember. Do not be intimidated. Please, do not be intimidated by any doctor. They are human beings just like you and me. They've got to put their pants on in the morning like anyone else. They leave the house after they brush their teeth like anyone else. And they are not gods. So please, be honest with your psychiatrist. That helps you. Tell them how you are feeling. Question what's going on if you have questions. Stop the session. Slow down the session. Ask questions when the doctor uses medical terms you don't understand. And you will be better informed and have a better understanding of these medications. You won't have to be so fearful of, oh my God, I'm getting these weirdo medications in a psych facility, like people used to really think, and be very fearful of them. And so, these are better medications nowadays. They work very well. They work on a number of different symptoms. Ask the med nurse at the facility for a printout about these medications. Often there is an availability of printouts so you can read about them, you can learn about them. As I said, sometimes a pharmacist comes to the unit and talks to the people about these things. You have every right to know what you're putting in your mouth and what you're putting in your body. And I have one other thing that's very important to say. Don't swallow the pills first and then ask what they were. That doesn't work. Ask what they are before you take them. Know the names. Know the dosages. Know what they look like. You're taking these meds. They're going in your body. You have a right to know this. I can't tell you how many people I've seen walk up to the med window, swallow the cup, take the water, and boom, and then ask, what the heck was that? You know, so learn about it. Ask about it. Talk to the doctor. Talk to the nurses. Don't be afraid. Thank you very much for letting me do this series with you. I hope this was very informative. I look forward to your comments. And again, remember, get help when you need it. Don't be afraid. Your life is worth everything. Thank you.